I'd like to welcome, especially at this time, our dignitaries occupying the frontmost seat. And I would like to invite Ms. Monique Crawford, team leader of business banking at Royal Bank of Canada, Royal Bank, RBC Royal Bank, to come and give us some remarks from an organization that has been standing by our research day for all these years and for which we say thank you. Please come.
Ladies and gentlemen, good evening. On behalf of RBC Royal Bank, let me say how pleased and proud we are to again serve as the title sponsor of the 7th Annual Research Day of the University of the West Indies. This Research Day plays an important role in developing the health sector in the Bahamas and provides a wonderful forum for medical students and medical professionals to exchange expertise and discuss best practices. I would like to extend special thanks and commendations to Dr. Robin Roberts and the entire University of the West Indies team for giving us this opportunity to again sponsor this initiative and for hosting such a fine program. RBC Royal Bank and RBC FinCo have been proud sponsors since the inception of Research Day. We recognize that quality health care is central to the strength and well-being of all countries. To be a strong, prosperous country, the Bahamas must be a country of healthy and well citizens. RBC is a keen supporter of medical research, hospitals, and healthcare. RBC's commitment to health and wellness includes the provision of financial and volunteer support to a range of organizations like UWI that advance the health and wellness of the Bahamas. To list a few, we have supported the fight against cancer by contributing to the RBC Children's Cancer Fund, the Ride for Hope, the Princess Margaret Hospital Foundation, and the Cancer Society of the Bahamas. RBC provides funding through our RBC Children's Mental Health Projects to community-based hospital programs dedicated to improving the health and well-being of all children. Also, in support of the improvement of community health service throughout the Bahamas, RBC is funding the multi-million-dollar critical care block construction project, which marks the single largest investment in the 60-year history of the Princess Margaret Hospital. In closing, I would again like to thank the University of the West Indies for the extraordinary work you do. I wish to recognize the esteemed Professor Trevor Hassel, who will deliver the RBC keynote lecture this evening, and take this time to warmly welcome you and the other visiting presenters to the Bahamas. I wish you all the best for a successful conference and your future collaborative efforts. Thank you.
Thank you so much, Ms. Crawford. We are impressed by your achievements as an entity to be reckoned with in the Bahamas. You have definitely been contributing in the ways that contribute to nation building, and for that we are very grateful. We look forward to a continued relationship because that's what drives things in the human race, isn't it? Beautiful relationships. And we thank you very much. Please convey that to the entire administration that you have an influence on. Thank you so much. At this time, we have Mr. Reginald Sanders from the Ministry of Education. I just met Mr. Sanders, a few minutes ago, and I already am impressed with his achievements and the sacrifices that he has made also towards nation building in his own right. He is in charge of the scholarship program at the Ministry of Education, or has a big hand in it. So I would like to ask you to welcome in a hearty way, a round of applause, Mr. Sanders, as he comes and delivers the message on behalf of the Minister of Education.
Thank you. Dr. Robin Roberts, my good friend, and we work together on a lot of projects, who is the director of the School of Clinical Medicine. Dr. Trevor Hassel, adjunct professor of medicine, physician, and cardiologist at the University of West Indies, Barbados. And if I had to go through his credentials, it'll eat up all of my 5 minutes. So he's a very accomplished gentleman and the keynote speaker. Medical practitioners, students, ladies and gentlemen, good evening. And Ms. Crawford, who is a good friend of mine. Ladies and gentlemen, it's a pleasure for me to be here today for a couple of reasons. And I'm going to break the ice a bit. Look at me. I'm a black man, 50-ish. You can tell I don't exercise much. I have high blood pressure that's controlled. I have high cholesterol that's controlled. I smoke, and I have the occasional drink. My doctor tells me that I'm a ticking time bomb. There are thousands of people like me in this country and throughout the Caribbean. So there's no place I would rather be than in a house full of doctors. In fact, I would like to take all of you home tonight, just in case. But on a serious note, you know, it's an honor for me to be here to represent the Minister of Education, Jerome Fitzgerald, to this very important 7th annual Research Day being staged by the University of the West Indies, Clinical Medicine and Research Bahamas, and in conjunction with the Royal Bank of Canada. Minister Fitzgerald wishes me to convey the sincere appreciation to the organizers of this forum and to the professionals whose work will be showcased during these lecture series. Over the last 10 years, the government of the Bahamas, and in particular the Ministry of Education and the Ministry of Health, has contributed millions, and I mean millions of dollars. And we have invested millions in the education of young, bright Bahamians like yourselves who are pursuing medicine at the various University of West Indies campuses. We strongly believe that this is not only an investment in you, but also, more importantly, is an investment in the lives of the citizens who live throughout the length and breadth of our vast Commonwealth. In addition to the hands-on service you provide patients, your research papers have influenced public policy locally and has impressed regional and international medical thought. We wholeheartedly support these research initiatives, as a significant amount of your research findings have related directly to childhood and adolescent health issues. And specifically for the ministry, we have created lesson plans that teach students how to manage their own health and to be responsible at an early age so that they can live better quality lives in adulthood. Although we are not quite where we want to be in specific areas like childhood, diabetes, obesity, high blood pressure, and other communicable and non-communicable diseases, we are a lot further ahead today in our country's brief history. So I encourage you, as your theme states, to continue to work toward advancing the population's health, striving to shifting the curve to a point where these conditions are eradicated from our landscape, or at least to a point where we can manage more effectively preventable diseases. The Minister looks forward to reviewing your new research papers presented during this series and seeing how they will benefit all citizens in the Caribbean. And I will end as I began. Since this is a research lecture series, I am available if you all want to do some research on me. I will gladly be taken on as a project in this regard. Thank you all, and the best in your efforts to promote quality health care and health education in the Commonwealth of the Bahamas and in the region. Thank you very much.
That was the most resounding informed consent I've ever heard. And we'll sign you up for what we are not sure of yet, but you will help us to reach this. We just have one sticky matter, the ethics committee. Thank you so much, sir. That is inspiring, and we appreciate that. We've always known that the Ministry of Education has us at heart. And what we can do to strengthen the Ministry of Education, we're really endeavoring to. So, apart from being a research participant, please come and visit us as a friend. Our doors are always open, up to about maybe 11 o'clock at night sometimes. Thank you so much. Having said that, and having drawn your attention to the handiwork of the director of our school, and I look at him also as the chair of the research committee, and Dr. Butler and myself as the co-chairs and assistants to a very busy man, I would like to invite Dr. Robin Roberts to come and give us the director's report to you, and following that, I will try to follow that act. And then we proceed into the evening's program from the academic side of things.
Good evening. I deliberately took the position and the director's prerogative that any report on the research program tonight should be given by Dr. Frankson. For you who spend a lot of time around the university, you will see that he's probably one of the hardest working members of our faculty. And so I feel that he deserves the honor more than anyone else to give a report of where we are. I just simply want to say that it is really a pleasure to invite you here tonight. In 1997, we started our clinical training program, and 10 years later, in his wisdom and in his vision for where we wanted to go, Professor Spencer turned us into the School of Clinical Medicine and Research, where research became a very integral part of our agenda. We started the research committee, we started an ethics committee, and ably chaired by Dr. Nelson Clark. And if you look at the track record, one can say that we have grown exponentially in the amount of papers that are being proposed to the ethics committee, in the amount of proposals that actually have been completed. We've had increasing numbers of presentations at CHRC, and most proud this year when we had a record of 13 papers presented by the Bahamian team to CHRC, and I think we ably performed, and we were awarded with having the best paper presented, a tie for first place by Dr. Rivers and Dr. Rogers. And I think it's true to say, to re-emphasize something that Mr. Sanders said earlier, that we are producing papers of quality and we believe have significant impact in healthcare delivery in this country. So I really welcome you and invite you all this evening and tomorrow that you'll be able to see the sort of work that we've been doing in our school, particularly in regards to research, and more importantly in our keynote speakers, those who are very, very well respected in their rights throughout the region and internationally for the research that they do. So again, I welcome you and I thank you all for coming. We're going to have a wonderful evening. Thank you.
Thank you, Mr. Director. Let me give you a few insights into research as I see it, right here at our school. Just a few. I came here on the 1st of April, 2009, my wife and I, and we were put up for a few days on Charlotte Street. Well, not on the street, but a hotel there. And then after that, Dr. Sinqui saved my wife and I's life and gave us some even really lovely accommodation on the hill. And after that, despite being grateful, I headed to Carmichael Road, where I go home to every evening. I carry research with me morning, noon, and night. I'm glad for my religious hours when I can shut down and leave it and then come back recharged again. And really, it has been a wonderful thing to see how research has grown over those years. When I came, the only thing that came to my office was a project from Dr. Carter looking on Helicobacter pylori in both children and adults. And afterwards, I began a process of networking like crazy. I met with all the lecturers and anyone else I could grab who had experience. And then I also started to work with the students and to get ideas as to what to do, where possibly to go. And from there, one of the things that became clear was that I should build on what has already been done. And I looked at the work that Dr. Roberts handed me from a strategic plan of sorts that was more of an action plan. And it was definitely in keeping with the university's strategic plan of the day. It was the brainchild of the then dean, Professor Howard Spencer, and his wife, Mrs. Spencer, who was really the research coordinator as a fellow in the department, in the school. After that, things became clear to me. This is a job for everybody. No one man can do it. So my strategy was very simple. Every person who came, I would sit them down and teach them how to manage research. And I would let them understand that this is their research, but it is our research. Because they should not try to manage it on their own. They should try to build a team around them, a small and effective team of wiser heads, and if they want, research assistants as well. And little by little, I also added, and you should find a way for society to pay for that. In other words, go out into the community for funds. All of these things have fallen into place. And the program that you have this evening, and if you were here last year, etc., those are the products of that system. To me, it's a simple system. It's a system that makes sense in our context. I can't say we have any high flyers in research on this humble campus. We leave those to the mother campus and other campuses that would dare rival the mother campus. But what we have is people who are slowly, as they interact with their advisors and with me, increasing capacity to do a good job of answering questions that are important both to them and to society, especially the Bahamian society, of course, as this is our country of residence. It then became clear that after that, what we also needed was to support that system with our directors of the postgraduate programs and undergraduate programs that had anything to do with research, meeting monthly, except in the summer, for maybe a month or two, but really meeting monthly and keeping a finger on the pulse of all of this. One of the things that we already had in place was a well-functioning ethics committee. I came here and I found that, and it has improved, if anything. And I see sitting right in the back there, my classmate, Dr. Nelson Clark, my classmate from Irvine Hall and the good old UWI from when the world was not really that young. But I want to just say thanks for your gentle, sagacious leadership through this process. Sometimes when he chairs the ethics committee meetings, I say, these are some of the things that our students actually should be invited to come and just sit and see, that there is another side to medicine, a side of taking care of people through community actions. And I am trying to impress that a lot of this be the experience of our students and indeed our residents, especially those that have more of a bias to prevention and community health. Really, this has been what has happened. We have looked at good governance and we have tried to promote it. It has been a pleasure seeing the program excel. Dr. Roberts just a while ago mentioned to you the fact that quite as a surprise to us in a way, we have seen rewards from awards that we have gotten. One of our presenters during this session, Dr. Manos Grimes, also was helping to make the Bahamas proud, and we'll tell you more about that just before she presents tomorrow. But such is the nature of it, and really, if I were to tell you more, it would just damage the program that we have here. So I'm going to stop at that for now, except to mention one thing. We're now at the phase where, Claudette, why are you laughing at me? I always do that in lectures, ending, but one more point. That's what Claudette is laughing at. This one thing, we have been researching and we have been presenting, but over the years we really haven't been publishing. So we, as a research committee, took that bull by the horn and had a double whammy research workshop for writing for publications and writing for grant funding. We had it from the 21st of March, the 22nd, that was Thursday evening, Friday, and for those folks who could not make it on Saturday, we had it on Saturday and we had it on Sunday for them. We repeated the Saturday part on Sunday. Each day was well attended. The librarians and the library facility accommodated us in the most beautiful manner, and this level of satisfaction for that was high. People from it got their ethics credentials as they went online, linked up with NIH and so forth, and it also has been a blessing. Well, what are some of the results? Well, probably, social results are hard to attribute to just one cause, but let me tell you what has happened. One of our presenters last year, Dr. Keith Rivers, is on his third paper now to be submitted. 2 papers having been submitted already. The first one by invitation, the second one by initiative, and the third one by initiative to the West Indian Medical Journal. The other person that was mentioned, Dr. Warner Rogers, she was also invited for another series on infectious diseases. That is a special series coming out of the West Indian Medical Journal to have her paper presented. Dr. Pinda Butler, a year or two ahead of that group, she has also submitted. The WIMJ has accepted, and they've just sent back the last proofreading, and we'll be publishing soon. It has been rewarding, and we are seeing several other people catching the fever now for publishing. Well, to tell you the truth, that was my agenda, to get people publishing. My director's agenda, though, was to get people bringing money into the school. That's why we had the other part about grant funding. Well, we solved that kind of last year. We said after we tried, and Dr. Manos Grimes will know the woes of that, we tried to go through the big sources, CHRC, etc., to get funding for some of the things that actually won first place. A mystery to me how the same organization gives them first place and didn't fund them. But we tried, and then we realized that we can do it locally. So we headed down to Commonwealth Bank of the Bahamas. We couldn't go to Royal Bank because they already have given us a huge, nice check for which we're always appreciative. At least we have a little decency about that. But we were tempted, and we headed to, I think, Super Values, head chain, because we said you're probably selling some of the stuff that we were at the factors leading up to what we were researching. We didn't actually tell them that, but that was what was going on in our heads, etc. And we were successful to the tune of maybe about $30,000 to $40,000. The money was never sent to any researcher. It was sent straight to the school. It was managed in an exemplary fashion, full accounting, showing that we have the maturity to handle funds dedicated to such projects. And we are proud and we're learning from that legacy. We haven't given up on the big NIH grant yet, though, and the big CHRC grant and so forth, or CARFA, as it is called now. As I said, I could go on for a long time. But thank you for being there with us. And one last thing. Our students, our medical students, are really flexing their muscles now in research. Two of them had poster presentations at CHRC this year, and we are seeing projects coming down the pipeline that are looking promising. Next year, we're looking at poster presentations as well, and even medical student presentations. Some groups have already been put on warning, or alert is more the word, and we're looking for great things. Thank you for making research what it is becoming here in the Bahamas. So, on that note, I'd like to ask Dr. Roberts to come back again, because there is a delightful task that I know I cannot do, because he was, about a year behind me in medical school, and then he went to Barbados, and he met this wonderful gentleman. I stayed in Mona, and I never met him until recently, hours ago. But we will have the pleasure of hearing from him. And I would like Dr. Roberts to introduce Professor Hassel for us.
I do not have to do much of an introduction. If you were to turn to page 11, you will have a peek into some of the accomplishments of Dr. Hassel. I had the pleasure of going to Barbados for my 4th and 5th year, and anyone can tell you who's been through Barbados that he was one of the best teachers that we had. And when you went to a cardiology clinic and the prof taught you how to listen to heart, how to take a good history, I'll tell you, you really appreciated what it was to be taught by a great teacher. And so it really is an honor and privilege. About 6 months ago, I was walking through the airport in Miami, and I was trying to think about getting a speaker, and lo and behold, I bumped into him. And I said, it's divine intervention. Just the man I thought would be most able in terms of presenting what we had in mind. And so without any further ado, I will let him come to the floor. Thank you, Professor.
Good afternoon, everyone. And let me begin by saying what a delightful pleasure it is for me to be here to take part in this very unique occasion. I've been given the task to speak to the topic of curbing the non-communicable disease epidemic in the Caribbean. And what I plan to do is to do so by, first of all, defining the epidemic. I shall address the causes. I'll speak to, yes, it's all working. I'll speak to strategic plans, declarations, and statements. And then I'll share with you some of the actions and approaches that I think we might apply. The burden of NCDs in the Caribbean is significant. NCD deaths are 5 times those from other diseases. In fact, NCD deaths are 10 times those of HIV/AIDS. And that is not mentioned in order to suggest that HIV/AIDS is not important, but rather to give you a sense of the extent of the problem of NCDs. This group of diseases account for 65% of the burden of disease throughout the Caribbean. Heart disease, cancers, diabetes, stroke, hypertension are the major causes of death in the Caribbean. This has been so for the past several, almost decades now. And this is reflected in the slide from Sir George Allen and Paho, which provides data for 1980 and 2000. The crude mortality rates of these diseases are significantly high. There you can see heart disease, cancers, diabetes, stroke, featuring prominently and significantly. The potential years of life loss for those under the age of 65 from chronic diseases is again significant, more so, as you would anticipate from what I've said earlier, than HIV/AIDS and injuries. Now, this data is for 2000 and 2004, and what is encouraging is that the potential years of life loss for HIV/AIDS has decreased during those 4 years. In fact, I suspect most of you are aware that this trend has continued significantly. I hope sometime that we'll be making that same kind of comment about the chronic diseases. The age-adjusted death rates per 100,000 for hypertension and diabetes in countries, a range of countries, Bahamas, Barbados, Guyana, Jamaica, and Trinidad and Tobago. The age-adjusted death rates for hypertension and diabetes, hypertension in the blue bar, diabetes in the yellow, is significantly higher than that in our neighbors in Canada and the United States of America. And in absolute terms, these adjusted death rates are higher than they ought to be. So what I've said thus far is that chronic diseases produce significant death in the Caribbean. And what then is what are the causes? What's the genesis of these significant deaths? These may be categorized as modifiable or lifestyle factors, such as exposure to tobacco, abuse of alcohol, unhealthy diet, and physical inactivity, and certain metabolic or physiological conditions, such as an elevated blood pressure, overweight and obesity, and cholesterol. Let us now have a look at the extent to which these risk factors, these conditions contribute to the chronic diseases that exist in epidemic form throughout the Caribbean. The Global Youth Tobacco Survey that was conducted in many Caribbean countries some years ago, data published from the then CAREC, showed that in blue, the males for youth currently using tobacco in percentages, the males were of the order of more than 10% in the Bahamas to as much as 25%, a quarter. For the females, the percentages are less. This is youth tobacco usage. For females, less, but still significant. Imagine in Haiti, current smokers of tobacco in Haiti and females is nearly 20%. In Jamaica, 15%. In the Bahamas here, 10%. You know, sometimes when you put this this data out there, one can't put it in real terms. What we're saying is when we walk the streets out there, 1 in every 10 of our young persons are smoking. That's the data at that point. What about the adult smoking? Here is St. Vincent, Jamaica, Trinidad and Tobago, and St. Lucia. And you can see, again, the males predominate with under 20% for St. Vincent, up to more than 35% for St. Lucia. On this slide, based on this data, again supplied from CAREC, those females, adults smoking in the Caribbean seems very, how shall I say, it's very low. Having said that, however, we should not feel very comfortable about this fact. Because as I mentioned in the earlier slide, among our youth, there is the numbers of the youth females who are smoking is range from more than 10%. The implication there is that our young women are increasingly smoking. An attempt has been made to assess the contribution, if you will, or the role played by smoking in deaths in CARICOM. And I just wish you to focus on this point and not so much the detail, in which it is estimated that 1/3 of all male deaths are due to smoking, and 15% of females. With due respect to my friend who spoke earlier, this is a serious matter. This is a serious matter. Exposure to tobacco smoke is the most preventable cause of death in the Caribbean. Please do not take it lightly. And where are we now? Okay. So what about other risk conditions, overweight and obesity? This, in and of itself, has virtually reached epidemic proportions in the Caribbean. Dr. Fitzroy Henry produced some of the most recent data in which he pointed out, to the right of the slide as you're looking at it, that now some 60% of all males are overweight and obese. And for females, this is almost 80%. You can see for yourself the trend over the years. This is something we need to address. Professor Wilkes, who is here in the audience, and I particularly like to recognize as one of the leading researchers in the field of chronic disease in the Caribbean, also provided some relatively recent information in which he showed that if you look at the right-hand bars, that overweight and obesity among themselves each accounted for about 30%, occurred 30% frequency. And note that the obesity prevalence is increased in Jamaica from 2000 to 2008 among 15 to 74-year-olds. The obesity epidemic is fueled by a sedentary lifestyle and by unhealthy diets. And the estimates are that in the Caribbean, on an average, on a range throughout the Caribbean, here I'm showing you Trinidad and Jamaica, some 50% of our people are not as physically active as they ought to be. Incidentally, in a survey that's carried out in many Caribbean countries, the so-called STEP survey, what was shown also is that only some 5% of our people in the region, 5%, consume the 5 portions of fruit and vegetables daily. And what of hypertension? Again, there's a range throughout the region, but this work, the so-called ISHIP study, this is a publication 1995, but it holds as good today as it did then, shows that on the average, a quarter of our people are hypertensive. This shows specifically the data for Jamaica, St. Lucia, and Barbados. But it's not only a health burden that the chronic diseases inflict on us. They also inflict an economic burden, a developmental burden for us in the Caribbean. And so, for example, studies from the TMRI unit at the University of the West Indies in Jamaica, published again some time ago, made the point that effective treatment of diabetes and hypertension, just diabetes and hypertension, in Trinidad and Tobago would consume 8% of the GDP of that country. I hope what I've done thus far is to point out that the chronic diseases represent a major health burden, that they are a major health burden as a result of and in association with certain well-recognized risk factors and physiological conditions. The impact further economically, as pointed out by Xian Chow of the World Bank at a chronic disease workshop in Jamaica last year, she pointed out that the health expenditure, this is important data, on a diabetic patient ranges from US $322 to US $769 per year, which is more than the annual per capita spending for health in the OECS countries. Data from St. Lucia shows that NCD patients spend 36% of their annual household expenditures on out-of-pocket healthcare costs for NCDs. And the burden is more on the less well-off than those that are well-off. Let me just pause to show a few images that help to show us how we've got to this point. So we've gotten there by an attraction for these types of foods. We've gotten there because of these types of advertisements. Can you imagine an advertisement that encourages us? You can read for yourself. A better start in life. Start Coca-Cola earlier. And we've gotten there because this is our preference. So that every Caribbean country that one goes to, one can see all of our roads clogged with cars, most of which have got one occupant. I was observing that for myself here in the Bahamas, in Nassau as well. Let's share another issue, tobacco, the significant advertisements, the attraction for the females, the alcohol, time flies when you're having a Bud Light. It's for these reasons that we have gotten to this point. I often also like to suggest that we've gotten to this point because of misguided indicators of progress. Misguided indicators of progress. If you think about it, the indicators of progress in accepted, for the most part, are how many televisions, how many cars, how many whatever energy-saving devices. It almost seems to me that one of the indicators are how many fast food restaurants you've got in your country. So misguided indicators of development. And you know it is for this reason that Bhutan, the country of Bhutan, introduced as an indicator of progress a happiness index. I am delighted to see that that concept is slowly but surely coming into the mainstream of chronic disease thought. So, I've defined the problem. I've shared with you the conditions, the risk factors that predispose to the problem. Let us now review some of the major strategic plans, declarations that have informed and continue to inform and direct our efforts as we seek to curb the epidemic of chronic diseases. And perhaps in an audience such as this, it is perhaps most important for me to begin in 2001, and specifically with the heads of government of Nassau Declaration, which stated the health of the region is the wealth of the region. This is a fundamental position that was taken by heads of government. This meeting of heads of government led eventually in 2007 to a quasi-cabinet meeting of CARICOM heads of government decision to hold a CARICOM summit on chronic diseases. This was held in Port of Spain in Trinidad, as I said, in 2007, and this now famous photograph shows those heads of the CARICOM that were present, and I'm sure you recognize your own among these distinguished gentlemen. What were some of the principles? What were some of the concepts that came out of that declaration of Port of Spain titled Uniting to Stop the Epidemic? Well, there was a decision to establish national commissions on NCDs, to focus on tobacco control, to screen for NCDs. Even today in 2013, throughout the Caribbean, many of our hypertensives go completely undetected. Throughout the Caribbean, many of our people with grossly abnormal lipids go undetected. And so there is need, so the declaration spoke to screening. It spoke to almost the reintroduction, if you will, of physical education, and not just education, but activity in schools, and the role of the media, and research and surveillance. And importantly, and this was symbolic, but it was important, it identified one day annually to recognize the problem of chronic diseases. And it's most appropriate, of course, that we are speaking on chronic diseases today, a few days after Caribbean Wellness Day was celebrated. The 2007 Port of Spain Declaration was the catalyst, and in many respects, the forerunner, if you will, for one of the most significant international or global developments around chronic diseases, namely the United Nations high-level meeting in 2011 on NCDs. As Kofi Annan puts it, it's a classic example of the Caribbean punching above its weight. That political declaration, again, spoke to reduction of risk factors, the need to strengthen national policies and health systems, the importance of research and development, and monitoring and evaluation. It also created an opportunity in which heads of state made commitments around chronic diseases. And I think it is important, again, in this setting that this be appreciated. So often, we in academia feel that we need to spend too much time in convincing our political leaders of the importance of certain issues. I say to you, this is one example in which I make bold to say that in many respects, our political leaders are, if not ahead of us, they are certainly very much in step with us on the need to address the NCDs. And so, in the interest of time, I'm not going to go through this in detail, but move on to yet another strategic plan. This is from PAHO, and this was a regional strategy and plan of action around the chronic diseases for Latin America and the Caribbean. And this plan highlighted the need for a multi-sector, all-of-society approach. And there are some comments and words you will hear repeatedly. It spoke to the implementation of the best buys of the World Health Organization. It spoke about strengthening and adapting health services for NCDs and the need to identify goals and targets. There's also a strategic plan of action that was produced by CARICOM and PAHO for the Caribbean region. And I share all of this with you because if you are seeking to address this issue, I am making the point that there is a significant amount of published literature and a record of a way forward that you should access. And so some of the priority actions in that strategic plan spoke to risk factor reduction, integrated disease management and patient self-management, and again, surveillance, management, and evaluation. But perhaps one of the most significant documents is WHO Global NCD Action Plan for 2013 to 2020, which has just been published. And it's a roadmap, it's a menu for not just WHO and international partners, but also for private sector entities and for sub-regions, and nations to adopt approaches leading ultimately to a 25% reduction in premature deaths from the NCDs by 2025. I want to close this review of the strategic plans and declarations by sharing with you also a strategic plan of action for civil society organizations in the Caribbean. And this strategic plan has been produced by the Healthy Caribbean Coalition, of which I happen to have the honor to be president. And the plan outlines strategies and approaches for civil society in the Caribbean to contribute to the prevention and better management of NCDs. This plan highlights the need and the role of civil society in advocacy, and I'll come back to that. The need to build capacity, the need and the role for civil society to contribute to what I refer to as the major communication gap in the Caribbean. Our people in the Caribbean simply do not know enough about chronic diseases. I look forward to the day when, yes, a meeting like this could be attended by, quote unquote, the average lay person. I look forward to that day. I'd be interested to hear responses. But believe you me, I make that point if only to stress the need that there is a major communication gap. And the other area that we think is very important and is the use of the technology by way of mobile health and electronic health in the NCD effort. And of course, the Bahamas allows for that. So, what should we be aiming for in broad terms? These 9 targets have been agreed to by the leaders, really, globally, including our own in the Caribbean. I'm not going to go through them. I'm hoping that the slide will be made available, particularly the presentation will be made available to the students in due course. But certainly you can see some of the big issues, such as 80% of persons screened for cervical cancer, salt consumption reduced by 5 grams per person per day. I said earlier that 25% of our people in the region are hypertensive. There's good data to show that if we in the Caribbean could simply, by legislation, by agreement with the manufacturers, by educating our people, if we could reduce the salt consumption down to 5 grams per day, this has the potential for almost reducing prevalence of hypertension maybe by 50%. How do we go about doing this? How do we go about seeking to achieve some of these targets? Well, again, as part of achieving the targets, curbing the epidemic, these are what are considered to be the best buys. In other words, any country that is looking to curb the epidemic of chronic diseases should adopt these approaches. They have been shown by WHO to be the most cost-effective. So with respect to tobacco use, significant increase in taxes, legislation for smoke-free workplaces and public places, appropriate warnings on cigarette packages, banning the advertising and promotion of tobacco products. Every Caribbean country should, as we speak here, as I speak here today, should have these implemented. After all, we have all signed the Framework Convention on Tobacco Control, which commits us in the Caribbean to implementing these measures. Alcohol use, unhealthy diets, etc., etc. These are your best buys. All of what I have said can be summarized and is recognized in this quote-unquote causation pathway of NCDs. It's adapted from a WHO publication, which shows you that those diseases are triggered by intermediate risk factors, by certain common, and then certain underlying determinants. Those of you who are familiar with this field, the so-called cause of the causes, which I haven't spoken much about, the social determinants, the lack of empowerment, the poverty, the poor housing. These are all conditions that predispose to the unhealthy lifestyles, that contribute to the high prevalence of intermediate risk factors, that lead to those 4 chronic diseases. There's also an appreciation and a recognition that lifestyles contribute to 51 or about half of the chronic diseases. The environment, another 20% or so, and medical care delivery, the standards of medical care, another 10%, with 20% being hereditary. And this is important. This is important as you try to explain this to your constituents. But the encouraging thing about all of this is that at least 80%, and I like to hold on to this information, 80% of cardiovascular disease, type 2 diabetes, and 40% of cancers, really, really quite remarkable, can be avoided through a healthy diet, regular physical activity, and avoidance tobacco. This is truly a remarkable statement, especially when you bear in mind that the cardiovascular diseases account for some 45% of the chronic diseases. So you can see, well, you can do the maths, as we say. Now, the curbing the epidemic requires an approach of the whole of society that involves the government, the private sector, and civil society. Each of these have their own special skills. The government has the skills and the responsibility for legislation, regulation, and taxation. Civil society has what is available to it: advocacy, a service provider, helps to provide evidence, and it acts as a watchdog. The government says it was going to do this, but did it do it? The civil society asking, you said you would do A, why has it not been done? And the business community has specific tools in this effort: philanthropy, product power, I like to use that one, and also a very important one, for the most part in business, in the business community, shared values. And so to get into the actions that might be taken, policy actions to reverse tobacco epidemic, we should use the so-called empower approach: monitor tobacco use, protect our people, offer to quit tobacco use, warn about the dangers of tobacco, etc. These are fundamental. And as we look going forward to address this epidemic, we should ask ourselves the extent to which these are being carried out in the Bahamas. Alcohol, another very challenging issue for us in the Caribbean, for all the reasons, many of which are historical and economic. But it is one that is contributing significantly, not only to death and disability by injuries and violence, but it is also a significant contributor to the NCDs, or chronic diseases. And so there, I've given you, as it were, a menu of things that ought to be done. Minimal legal age to buy alcohol. I would like to highlight the last bullet: oversight of alcohol availability, promotion, sponsorship, and consumption at major national festivals. I don't know about in the Bahamas, but in Barbados, it seems to me that every week there's a major national festival of which there truly is an abuse of alcohol. This is an issue we need to address as people responsible for contributing to the development of our people in the Caribbean. Physical activity, there are a set of recommendations throughout the life course from age 5 to 17 years, 60 minutes of moderate to vigorous physical activity, and as one gets older. There is no age. You are never too old. I was going to say to have sex, but that is true too. But you're also never too old. You're never too old to engage in physical activity. And there should be a whole of government approach. And this is an important menu, for so often we think that this issue can be and should be tackled by the individual and is the responsibility of the individual. Yes, it is, but there also needs to be an enabling environment. And I have highlighted some of the actions that need to enable, to make it easier for the individual to pursue this lifestyle. Strong policies to reduce availability of tobacco and alcohol. Control and advertisement of food to children. Reduce market pressures from influencing dietary choices. Make local fruit and vegetables available and affordable. And the list goes on. But there's also opportunity to address these issues in particular settings. And the reason for the doing so is that these settings create, as we refer to it, a captive population. The setting is in and of itself an enabling environment. One can easily demonstrate results. And some of these, you would all be familiar, are the school, the workplace, the churches, the markets, the cities, the countries. I've put healthy countries there deliberately because it allows me to share with you a concept that I have been promoting and I'd like to promote here this afternoon. And that is that perhaps the Caribbean should seek to promote itself internationally as the Caribbean, the healthy lifestyle region. In other words, if you think about what I am saying, many of the ills, many of those conditions that impede development in the Caribbean can be covered and addressed under the title of healthy living. So whether we're discussing the chronic diseases, whether we're discussing illicit drug use, financial mismanagement, the breakdown in the home, issues around the church, call it whatever you will, they can be encompassed in that area. I'd love to see the Bahamas take the lead on something like that. I think you're fabulously well placed to do so. Where are we? Okay. And just a very brief slide with respect to the situation in the workplace, but in the interest of time, I'll go past that. And come to the issue of chronic disease management, because at the end of the day, individuals will still be subjected to chronic disease, and there are certain fundamental approaches that need to be applied in the management of chronic disease that is different to the management care of other situations. So management guidelines, but not just guidelines, adherence to guidelines, active follow-up of patients and the use of support groups, clinical audit and research. There is definitely not enough of this in the Caribbean. We need far more of clinical audit and research. And so we come then to this multi-sector approach. What I'm saying then is that the risk factors of tobacco, unhealthy diet, physical harmful use of alcohol. In the middle column, I've highlighted then actions that should be taken. Full implementation of the Framework Convention on Tobacco, Control for Tobacco, with respect to unhealthy diets, reduce salt, sugar, fats, promote vegetables. For physical inactivity, urban planning, healthy transport. For the harmful use of alcohol, regulate and respond to marketing. And then on the right, as you're looking at it, the different ministries that need to be engaged. Overriding all of this is the role of advocacy with health impact assessment, with also the creation of healthy settings. I want to spend 2 seconds stressing the importance of civil society and an empowered people in this whole exercise. Because I truly believe that in order to really bring about change in this area, we need to find a way to deepen the democratic process throughout the Caribbean. I repeat that. We need to find a way to deepen the democratic process throughout the Caribbean. I think, therefore, civil society needs to be engaged between election blocks of every 5 years. Civil society needs to be engaged in the process. And the Healthy Caribbean Coalition, which is a regional alliance established as a result of the heads of government Port of Spain meeting, has been established to contribute to this chronic disease effort, particularly by, among other things, empowering people. This just gives you an overview of the organizational structure of the Healthy Caribbean Coalition. Our patron is Sir George Alleyne. Our special advisor is Dr. James Hospitalis, director of CARFER. And we've got, on our emphasis is advocacy, communication, health, and capacity building. And the membership consists of health NGOs and civil society organizations throughout the region, faith-based organizations, trade unions, the elderly, etc. The organization has been engaged in several projects, but there are 2 I want to highlight here for you. 2 I want to highlight, and in particular, I'm now speaking to the medical students. I wish to engage them. One of the efforts that we're engaged in is an advocacy initiative using the electronic media. So we've got in place an electronic petition for cervical cancer, in which we're asking people we're asking people to go online, www.cervicalcancernow.org, and sign the petition. The petition has been signed by quite a few leaders of the Caribbean already. Prime Minister Douglas, Prime Minister Portia Simpson, neither Minister of Health or Prime Minister of the Bahamas has yet signed. I am now issuing an invitation. I don't leave until Saturday morning, so I'm free anytime tomorrow to meet with any of these goodly persons to have them sign. I say that half in jest, but it's a serious point, because at the moment, I think our numbers are now something like 5,000 petitions. When we have gotten to of the order of about 100,000, we then plan to present the position to heads of government of the Caribbean with a view to trying to influence them to make provisions for better care, to prevent our women of dying unnecessarily from cervical cancer. I don't want to digress and go over into that area. The other issue that I want to share with you, for those of you who are interested in alcohol policy issues, we've established a network, an online network. It's called CaribaPan. You can just go and Google CaribaPan, And if you'd like to become a member, then you're welcome. It's a forum for bringing together policy advocates in the Caribbean around the issue of alcohol. This is a slide that has to do with a significant grant that we just secured, but I won't bother with that detail. I want to close with this slide: monitoring and evaluation and surveillance. And I'm going to go through each bullet. And I wish to highlight this because this whole area is a major weakness, and by extension, therefore, it's a critical need for us in the Caribbean. I hope those of you who've been paying attention will notice, and I say this without apology, that some of the data that I've provided has not been as up to date as one would wish it to be, quite frankly. Now, I am aware that there is more up-to-date data, and we are looking forward to that data being not only sourced, but verified so that we can use it in a more sort of generic and international way. But having said that, there is no question about it. This is a major concern. And the monitoring and evaluation and the surveillance should not just be about health, but the economic impact of the NCDs. I'm also suggesting that this area, research around this area, should be viewed as essential national health research. And that governments of the Caribbean should include in their budgets research on chronic disease as a specific commitment. Because if we say that chronic diseases account for 7 in every 10 deaths in our region, then this needs to be given a meaningful priority and meaningful action. And so much of this work can be contracted out to academia. But not surprisingly, I am encouraging that there should be in this research involvement and engagement and active participation of civil society and the private sector. One of the challenges is in translating very often research into action. There are no better persons, I posit, to do this than perhaps the private sector. And then we should have and put in place and implement a mechanism for sharing all of this. And so finally, we should look at the big picture as we look to curbing the epidemic. And that's the message. This is not something that can be addressed by one individual. It requires a whole of society, a whole of government approach. We shouldn't look at it from the point of view of only diabetes and heart disease and cancer and risk factors and so on. But we should look at it in a much broader, holistic way. We should appreciate that education is involved, information, agriculture, transport, finance, urban development should all be part of the process. So I look forward to the day when in each Caribbean country there is a special committee of representatives of different ministries specifically to address the NCDs. And we should also involve in this exercise to see the big picture, civil society and the private sector. And so, as I say, extend thanks once again. I simply wish to leave you with the broad thoughts and concepts that the chronic diseases are a major threat and a major burden, both in health as well as a financial burden. And it is important for all of us to appreciate that unless this issue is tackled in a meaningful, deliberate, planned, whole of society, whole of government way, as pointed out by one of our prime ministers, a prime minister, not a medical doctor, made this observation. All of the gains made by us in the Caribbean post-independence can be wiped out unless we address these NCDs. Thank you very much.